issues, ne? But I also need to be to make you guys have this at the back of your mind that alginate gets affected by external factors. So in terms of like your setting time and your working time, né? If let's say for example you use a lot of water, or you're at a practice that doesn't really have like measuring cylinders, if you use a lot of water, your alginate is going to be runny, meaning what, it's going to take longer to set in the patient's mouth, né? And then if you use like less water than prescribed, then it's going to set faster. So you might find that by the time you actually put it in, you put the tray in the patient's mouth, the alginate has already set. So just always keep that in mind, as well as even external factors, like I was saying, with like room temperature and stuff. In during winter time, for example, it takes longer for alginate to set. So yes, you might have used your 2 scoops of alginate and your 2 measuring cups of water, but because it's winter and because it's cold, it's going to take longer for the impression to set. So that the dentist or you can have to continually check to make sure that the alginate is set before you take it out of the patient's mouth. Whereas like right now, in your summer or in your warm seasons, it sets faster. So obviously even you as the dentist, you have the assistant, you have to mix faster, you mix quicker, so that you can get it into the patient's mouth faster, so that by the time it sets, it's already in there and you guys don't have issues. So yeah, basically just make sure that you have that at the back of your mind when you're mixing alginate, okay? And then from there, then they talk about your bowls and your spatulas. Your bowls must be, your mixing bowl must be a flexible mixing bowl, but I think they'll show you that during your practical sessions in the dental lab, né? And then from there, everyone and every practice must have a mixing spatula. So that's just to mix the alginate properly, make sure there are no bubbles, make sure there are no voids. Yeah, so it's very important. And then there are like other mixing methods, but we'll get to that a bit later. Then the trays, we have your perforated trays as well as your rim lock trays. So with the perforated ones, basically, as you can see, they have little holes in them, so that when you actually take the impression, the material, the alginate, can ooze everywhere, so that it's able to like set properly, né? So that when you take the impression out, it won't stay in the patient's mouth. Hence we use your perforated trays. And then I suppose your rim lock trays would be then the ones that are unperforated, but really no one uses them anymore. Alginate really requires perforated trays, so that the alginate sticks to the tray and doesn't stay in the patient's mouth. And it actually, by oozing, it goes everywhere to ensure that it takes a nice 3D cast of the patient's mouth, né? Then from there we have, okay, alginate impressions. So this next slide, I think we're at slide number 7, it talks about preparing the patient and preparing the material and the tray. So obviously when the patient gets there, let's say they need a partial denture, you're going to seat them in the chair, you're going to put a bib on the patient, and then from there you're going to seat them, place the head onto the headrest, né? Then you're going to explain to the patient that, okay, we're going to use these trays, we're going to mix material so that we can get like a model or a picture of your mouth. Try and use like layman's terms, like we're taking a little picture of your mouth, so that the patient has a rough idea of what you're saying. Don't now use like serious dental terms with a patient, okay? So then from there, also again, it depends on what type of practice you're at and what the dentist expects of you. But basically, when you are, I think, but you guys will cover this at during your practical. So by preparing the patient, ne, you're gonna first go, let's say we're taking a maxillary impression now, ne? you're going to take your 3 scoops of alginate with your 3 scoops of your measuring cylinder, né? And then from there, when you take and then you're going to obviously mix with your mixing spatula in your flexible bowl. Mix quickly. Make sure there's no bubbles. Mix like you're making pap, guys. Like mix, and yeah, but they'll show you how to mix in the lab, because I feel like if I explain it too much, you're gonna get confused. But basically, you're going to mix, and then once you're done mixing, you're going to load it onto your tray, né? So when you load a maxillary tray, you're going to load it from the back, né? So you're going to put all your material like this. Does that make sense? Load it from the back, and then it's going to run to the front. Does that make sense? Then from there, your maxillary trays, you take them, you load. When you place them into the patient's mouth, you put the posterior part of the tray first, and then you're going to then push it in an upwards motion. So does that make sense? Yeah, but I think you guys will cover it in the lab. So when you're taking the maxillary impression, take it from the back, okay? Back, tell the patient to open as wide as they can. Retract any soft tissues. Up. Does that make sense? Yes. And then with your mandibular impressions, 2 scoops alginate, 2 scoops of your water with your measuring cylinder. Then you're going to mix. Remember working time, né? And then still with the mandibular one, you're going to place your alginate on the lingual aspect. So you'll be doing this with your mixing spatula, né? In there. Don't go on the outside. Place it from the inside on the lingual aspects. Ooh, can you guys see that? Yeah, lingual aspect, né? And this one, you check the patient. You place the impression from the front, not from the back. So this one also as well. Posterior aspect first, ne? The posterior aspect of your tray first, back, ne? So you retract, one side, But I think you guys will practice that, but I just wanted you to just see. Then once you are done, once it's set in the patient's mouth, you're going to remove it, ne? And then you're going to wash off all the debris, all the saliva, all the blood if there is, ne? And just make sure that it doesn't have too much water. And then from there, you're going to disinfect. You're going to disinfect your impression. Then you're going to store it in an acceptable place, such as a fridge or in a plastic container. And then you're going to send it off as quickly as you can to the lab. Before you send it off to the lab, you would have filled your lab slip in. You wrote the patient's name, date of birth, cell numbers, etc., before you send it off to the lab, ne? Then afterwards, you're going to wipe with a paper towel your mixing bowl as well as your mixing spatula. Then you're going to disinfect or sterilize them as well after every patient. Okay, so please make sure that you cover that. And then, okay, so removing the alginate impression, like I mentioned before. So you're going to rinse with water to remove debris. You're going to spray with the disinfectant. We talked about that. Then you're going to store in a labeled, covered container. Some practices, ladies and gentlemen, they don't take their things to the lab. Like it's not it's not ideal for them to take their things to the lab every day. So some would advise, like, you're going to wrap it in a bit of paper towel, a damp paper towel, put it in a plastic with the patient's information, and you guys are going to stick it into the fridge up until it's time for it to go to the lab, or the people from the lab actually bring someone to actually collect all of the specimens that you guys need to give to them. Okay, then from there we're going to talk about wax bite registrations. Okay guys, then we're going to talk about wax bite registrations. Okay, so basically wax bite registrations are important because they help establish an occlusal relationship between the patient's maxilla and mandible, or rather you can say maxillary arch with their mandibular arch. So normally wax bites are taken as are taken for study models, especially in orthodontics, but in some private practices like the ones I've worked at, you also take them when you're doing partial dentures, just to help the lab, get a rough sense of the patient's occlusal pattern, so it ensures accuracy and that the patient doesn't return multiple times because the occlusal relationship is not correct. So normally the wax registrations are horse shaped. And then from there are two types of materials that are used. There's your wax sheets. That's like the most popular type of way to make a wax bite registration. And then the less popular one, especially in South Africa, because it's a bit more expensive as a material, is polysiloxane. Not that it's not used, it's just more expensive. So basically, with the polysiloxane, we're gonna get like an extruder gun, which you'll probably see in the lab, and then it comes with a dispensing tip. But the dispensing tip, you can't like disinfect or sterilize. It's a single-use tip. So you're gonna mix the material, or you're gonna take it out from the extruder gun, and then you're going to place it on the patient's the occlusal surface of the mandibular teeth. The more common one would then be the flat sheets. So this procedure you must know. So with the wax sheets, you're basically going to fold them. It's terrible explaining things when I don't have them in front of me, but anyway, you're basically going to fold the sheets so that they look like a horse ridge shape. And then from there, you're gonna normally to flatten the sheets, to make them a horse ridge shape, you normally either use a torch, depending on the practice, or you're gonna dip it in warm water. So obviously when you put it in warm water, it's gonna function like a candle. It's gonna melt, so it will be easier to shape to the desired shape that you're looking for. So firstly, you're gonna as well put a bib on the patient, and then you're going to explain the procedure as a dental assistant, that we're gonna take wax bite registration. So basically, it's just the relationship of your upper and your lower teeth. And then from there, you're going to tell the patient that once we put the flat sheet or the polysiloxane on your bottom teeth, we're going to ask you to just bite. Sometimes you may be forced to actually practice with the patient to bite in occlusion. I normally don't do this, because the moment you tell patients to do that, they start doing funny things. Like we're in a Mapiano video. No. So I just normally tell them, I'm going to put this material in your mouth. You're just going to bite closed. And then they're just going to sit like that. Because the moment you start practicing, they start doing all these funny things you can't account for. So just tell them to bite. So you're going to tell them, when you bite, you're going to bite closed. And then from there, you're going to wait 1 or 2 minutes until it's set. And then once it's set, the wax is set, or even the polysiloxane, when you place the polysiloxane on the patient's teeth, you're going to tell them, okay, I'm going to put the product on the top of your bottom teeth, then I'm just going to ask you to just bite. Then once they bite, just tell them to sit like that for like a minute or two, and then afterwards you can take out the registration, be it wax or polysiloxane. Gonna take it out, and then you're gonna go to your sink. You're gonna rinse it out just to get rid of any debris, saliva, or blood. Then you're gonna disinfect it. You're gonna go back to your lab slip and make all the notes for your technician. This is from such and such a practice, let's say Dr. Mokabi Dental Surgery. We want to make, let's say, orthodontic models. This is the patient's name. This is the patient's cell number. And then you're going to store it. And then you're going to send it off to the lab, or you yourself are going to make diagnostic models depending on the practice that you are working at. So those are the two materials, and then just basically know the procedure of how they get used. Okay, and then next we have reversible hydrocolloids. I need to be very honest with you guys. I have never, ever, ever, ever used them in private practice. Even in varsity, reversible hydrocolloids, an example, the brand name, if I can put it that way, is known as Agar Agar. We literally only used it on the peripheral surfaces of our trays just to get a better adaptation of the structures in the oral cavity, but like no one uses it. But anyway, I have to teach you guys. Okay, so it provides for better accuracy, so it's much more accurate as compared to alginate, which is the irreversible hydrocolloid that we learned about earlier on. So Agar is basically used especially in crown and bridges because it brings about just a very superior or very accurate description of your intraoral tissues as well as teeth, and it's mainly used for final impressions, as we had mentioned before. And then the main problem with it is the setting time. It takes about 10 minutes to actually set and for the reaction to occur, and it doesn't really function chemically, if I can put it that way, the same as alginate, because with Agar or with reversible hydrocolloids, they go from a solid state to a liquid state and then back to a solid state because of the thermal reaction that takes place in the oral cavity. So, oh yes, like I said, it begins as a solid. And then the main disadvantage, like I said, it takes a while to set, and then from there it requires additional equipment. This additional equipment would be things such as tubes and cartridges and syringes, as well as a hydrocolloid bath, which is like a conditioning bath, a cooling bath. Like, there's just so many stories. I've honestly just never seen it in private practice. And even in varsity, we hardly used it. We just learnt about it. But yes, you might stumble across it, but I'd be very shocked. But nice to know, especially irreversible hydrocolloids and Agar, like that's an